Hello, everyone. We are glad you are tuning in for this video recording of our 2023-2024 grant year kickoff meeting. We've got some exciting updates to share with you on AZOHC activities and direction for this grant year. I'm Brianna Miller, coordinator for the Arizona Oral Health Coalition. You will also be hearing from Tara Wallstad today, another member of our leadership team, throughout this presentation. We would also love to hear from you. So if you have any questions, want to give any feedback, or have any other comments after watching this video, please reach out to us. You'll find contact information at the end of the presentation. You'll also find any links mentioned in the presentation linked in the description below. These past couple of years have posed new challenges and exciting opportunities for the Arizona Oral Health Coalition. Despite being a mostly volunteer coalition and seeing workloads at day jobs increase and mental capacity decrease as a result of COVID-19 and everything going on in healthcare right now, AZOHC members and the Leadership Council have worked hard to grow the coalition's reach, inspiring more folks from medical and public health professionals, students, and lawmakers to care about oral health as essential to overall health. AZOHC has worked to form new and exciting partnerships that serve to elevate oral health as a factor in overall wellness and well-being, and has enjoyed connecting over these past couple of years with oral health advocates from across the country through the Oral Health Progress and Equity Network and at the National Oral Health Conference. We know that we are louder together and are always looking for more partners passionate about a healthy and thriving Arizona. For those of you who have been members throughout this time for a couple of years, or maybe even just this year, what has been a key moment for you in participating in any of our Arizona Oral Health Coalition activities? I know for me, it was definitely getting to participate in our annual Capitol Day. Our day at the Capitol was a big success and really something that stood out for me this year.
The AZOHC has been awarded a grant through the CareQuest Foundation for another year, through June of 2024. With this funding, the AZOHC will be continuing our work to advocate for oral health policy and to build connections among advocates and professionals in Arizona. If you've been following the coalition in the past year, then you can expect to see a lot of the same events, and this year we want to add some new opportunities to get involved. So let's take a look at the plans for the upcoming year. Our two main focuses as a coalition will be advocacy and building partnerships. This has been our bread and butter for the past few years, and we want to build on that momentum. The AZOHC will continue to advocate at the state legislature for policies that will promote the oral health of all Arizonans, especially those who experience health disparities. In the 2023 session, we got so close to seeing a preventative dental benefit included as part of access coverage, but unfortunately this was not included in the budget despite wide bipartisan support. However, because of the work of dozens of oral health advocates, we had conversations with lawmakers and saw a level of interest in oral health policy that we haven't seen in a while. We will be continuing to ensure that oral health is a priority at the Capitol, and you can join in the effort in several ways. Before the 2024 session, the AZOHC Advocacy Committee will continue to meet and develop our policy priorities and strategies for the next year. This work group is a cross-sectional group of advocates from a variety of professions and sectors. If you are interested in digging into the work of advocating for oral health, this is the group for you. Also, during the next year, we will provide several other advocacy opportunities. Keep an eye out for weekly policy calls during the session, advocacy toolkits, and our annual Capitol Day event. Our other main focus for the next year will be building connections and partnerships through networking. We've done some of this in the past, but we're really excited for this to take a front seat this year. As a coalition, the purpose of the AZOHC is to work together for a collective impact. So providing the spaces for people to connect is an important role. In the coming year, there will be a variety of ways to meet others and make connections, including webinars and CEs, networking events, and our annual conference.
AZOHC will also continue supporting important integrative oral health initiatives and supporting the partners in our network doing this work. These initiatives include teledentistry, which is an important tool for bringing care to rural communities and to patients. We will continue supporting partners like AT Still and ASDO in promoting teledentistry as an important tool for oral health equity and increasing access to care for marginalized populations. We will continue supporting administrative changes, including payment parity and inclusion of the comprehensive exam in teledentistry, and working with our managed care plans and providers to elevate teledentistry as an important tool. Dental therapy. Arizona Oral Health Coalition members were instrumental in seeing the law authorizing dental therapists to work in Arizona passed in 2018, and have been working with stakeholders and with the Board of Dental Examiners for the past few years on getting the administrative rules passed so dental therapists can be licensed to work in the state. AZOHC will continue to support our partners, the Alliance for Community Health Centers, Pivotal, the Advisory Council for Indian Healthcare, and the Intertribal Council of Arizona on the next phase, implementation. Social determinants of health. So the Arizona Oral Health Coalition has been working with ATSU on developing a curriculum for oral health providers to better understand the social determinants of health and health equity, as well as be able to screen for social determinants as part of the oral health visit and make appropriate referrals using Arizona's closed-loop referral system, Community Cares. AZOHC has been working with providers to elevate understanding of oral health in the context of the social determinants of health framework. Speaking of this, we will be hosting a webinar on August 18th from 12 to 1 featuring Unite Us on the Community Cares platform or the closed loop referral system. This webinar or presentation will explain all about how the system works and why and how oral health providers should participate. The registration link, again, will be linked in the description below. We hope you can make it.
In order to ensure our next year is a success, the AZOHC is undergoing a few changes. For our members, these changes will not interfere with anything you've come to expect from the AZOHC. In fact, the goal is to improve how our members engage with the coalition. The main change is that instead of a volunteer leadership council, we will be shifting to a small team of part-time paid positions of staff members who will facilitate and support the work of the AZOHC. These staff members will guide the efforts of the AZOHC to make sure that we're meeting grant deliverables, and they will take care of a lot of the administrative work that is so crucial for our success, but is not something a volunteer has access to. The coordinator will be responsible for working with our fiscal sponsor, Children's Action Alliance, to make sure that we are on progress for meeting our grant goals. The coordinator will take on a wide variety of leadership roles, including facilitating meetings, providing communication support, growing coalition membership, and engaging with stakeholders. Each lead is associated with a priority area for this year and will coordinate several of our main projects. Each lead will provide administrative support for the AZOHC members, including scheduling and hosting committee meetings, updating the coalition website, adding content to the newsletter, and other activities. The advocacy lead will facilitate the coalition's advocacy workgroup. Also, they will play a role in exploring new opportunities for advocacy and engaging stakeholders in the development of coalition advocacy priorities. Next year, the advocacy lead will coordinate the AZOHC Capital Day event. The member engagement lead will play a big role in maintaining connections and communications between our members and partners. They will take on tasks like putting together the newsletter and facilitating networking hours. Next year, the member engagement lead will coordinate the AZOHC annual conference. The integrative health lead will primarily manage internal and external partners to support projects that align with the AZOHC goals and deliverables. This lead will build and maintain relationships with coalition partners to provide support for integrative health initiatives.
While we are changing our structure to support a more member-centered way to engage in AZOHC, we still have plenty of ways you can continue to engage with the coalition during that process. One of the first ways is through our advocacy committee. This committee is meeting weekly right now during the legislative session, the session which refuses to end. But this committee is dedicated to seeing an adult dental benefit for adults who participate in Medicaid or access. We want to see this bill passed at the legislature, and we also support other policy priorities that increase access to oral health care. This committee spends time strategizing, developing outreach material for the public and lawmakers, and also planning AZOHC's Oral Health Capital Day. If you are interested in policy but don't have any policy experience, that's okay. All perspectives and experience levels are welcome. Stay tuned for networking hours coming to you soon. We will soon start having opportunities for virtual networking or happy hour, basically getting to know each other and getting to know the work that our amazing members are doing across the state. We'll use this time to find out how we can help support and uplift the incredible oral health work that you all are doing across the state. And then we'll have webinars, of course. So our partners, Northern Arizona Oral Health Coalition, is hosting a webinar speaker series. You'll find information about that linked below in the chat. And AZOHC will also be hosting our own webinars on important topics to our network. So these webinars will be chances to increase your understanding of the oral health landscape in Arizona, and will also be another opportunity and a chance to make connections and get involved with our work and the work of our partners. We have some really exciting webinars coming up in the next couple of months. If you will check the link in the description, you'll find a way to view all of these exciting webinars and register for them. And lastly, you can connect with us on social media and sign up for our newsletter. Signing up for our newsletter is the best way to stay in contact with us and stay up to date about all of the events and the things that are happening at the AZOHC. You can sign up for the newsletter at our website at azohc.org.
We are super excited for the next year and can't wait to jump in. Please reach out to the Coalition email if you're looking for ways to get involved, want to apply for a staff position, have questions, or want to connect about anything else.